Hi, my name is Mercedes Dodge. I'm a psychiatric PA, and I am here to talk about how psychiatric symptoms and physical symptoms collide. I'm also raffling a prize for a Psych Congress PA Institute conference in December 11th to December 13th. And I wanted to invite and talk to another colleague, a respected, well-known Ariana Golchin. I'd like to have her introduce herself.
Hi, everyone. My name is Ariana. I am an internal medicine PA, and I was recently diagnosed with Hypermobile Ehlers Danlos Syndrome. I spent so many years of my life being told that I was making up these symptoms. It was all in my head. So many years of being medically gaslit, but it was far beyond.
Yeah, I think there's a lot to unpack there. I have a lot of patients in psychiatry that are resistant in trusting the medical world. And I think that sometimes just listening to their story, because they know their body and their mind. And so I'm just so thankful that you have come to a place in your life journey to realize I am not going to allow this to continue. This gaslighting in my head, this gaslighting with the medical world. I am in the medical world. You've created a shift in the way you're going to approach your care and your body. So it's very inspiring that you came to this and realized something is off. How did you go about letting go of all that negativity, that gaslighting that I feel like you've been living in?
There have been so many times you hear for years and years, this is all in your head. You are just stressed out. As I'm going through PA school, I'm facing all of these stressors. As I am kind of moving into this new transition in my life and I am coming out as a queer individual, I have more stress. As I'm taking on these various roles in medicine, I'm facing new challenges in my life. And so I'm hearing all of these medical professionals tell me, you are just a female. This is in your head. You're physically manifesting these symptoms in your body. And to me, I'm like, you know what? You're right. This makes sense. Oftentimes we can manifest stress physically. And so after I've heard these things for so many years, I'm actually convincing myself this is in my head and they are right. But after a while, I started to continue to feel I was having physical symptoms that did not make sense. They just weren't correlating, they weren't adding up. And while we can manifest these symptoms physically, causing ankle tears in my ligaments and my shoulders subluxing when I'm sleeping and my ribs subluxing, these kinds of things were not being explained by things I was making up in my head. So I continued to dig a little bit deeper from that aspect and dive into my own research time.
Yeah, I think there's so much that we continue to learn about our own body and health. Someone with anxiety like myself, I've learned that it's okay to not be okay and to realize you don't have all the answers. Leaning into my journey has allowed me to realize we have to show ourselves more grace. No one's going to speak up or stand up other than yourself. So you being able to take a pause in your medical care and say, I need to learn myself. And granted, you are in medicine, so you're able to understand it more. So I guess my question goes to, how does having a physical or a psychiatric condition impact how we approach care? Because I think that is a vulnerable spot many providers don't talk about. We're all human. That sometimes when we go into medicine, we think that we know it all, but we don't. And sometimes our lived experience actually help us become a better connector with our patients in whatever specialty. You don't have to be doing mental health or psychiatry, but if you continue to grow as a person and understand your journey a little bit more, the more curious you remain with your patient.
When I was thinking about it from a patient point of view, but now that I am tuning into this chronic illness side, I'm really trying to see things from a provider lens and a patient lens. So when you asked me that question, I was thinking of it as a patient, but as I'm thinking of it as a provider, 100%, we see ourselves in them many ways. And I've been approaching care so differently. I am so privileged to have the foundation of medicine to question these providers, to dig deeper and to really understand and question when things are not adding up and to be an advocate for myself. It's really given me a lot of perspective and more empathy for my patients because not everyone can. Majority of our patients cannot do that. They don't have the tools, they don't have the support, they don't have the resources. And so they're 100% confiding in us to do what is right for them. And we're failing them as a healthcare system. And that is really devastating to me. Having this experience myself, which has been really painful and gutting, has allowed me to dive into this healthcare provider role from a different lens and say, you know what? These patients do not have this privilege and we need to be better. And that means using my platform, using my advocacy, using my voice to really put myself out there, be vulnerable, be super uncomfortable at times in sharing really difficult parts of my life, but giving the public or patients tools to help them be better advocates and use their voices because they may not know how. And that's really hard.
Give you so much props for being vulnerable and talking about your chronic illness. That's taken a while for you to find the right providers and therapists and team to support you. I guess I want to shift gears because I think that both you and I are big on education, but we're also big on our own self-discovery and being able to grow as a person. What are the things that you realize any PA can diagnose EDS? I think EDS is so underdiagnosed, right? And I don't think a lot of people understand the connections between the physical and the mental. I have had a couple of patients with EDS, those that came in with a diagnosis, as well as those that discovered the diagnosis with treatment with me, since I'm a psychiatric PA. And I just see how it all interconnects. So what are we missing on educating our future PAs or providers about EDS?
Absolutely. I love that question. And it's kind of a question that continues to unfold as I've continued to dive into this diagnosis because I am not an expert. I am not an EDS specialist. And the best part is there really aren't EDS specialists. We're all out here in this community figuring it out, leaning on each other, and really asking providers to just be willing to see us, to hear us, to validate us. Just because you didn't learn about it in your education doesn't mean it's not real, or just because it doesn't make sense to you and you can't physically see it sometimes doesn't mean it's not real. So I work a very intensive job, very intensive hours. I look normal. And so people don't believe me. And so we need providers, we need all members of the healthcare team to change how they view the standards of chronic illness. That's what we need. We need people to change their idea of what chronic illness or anything in that matter looks like, because that's where we start causing harm. EDS is in every specialty, just like mental health is in every specialty. There is not one correct specialty for being a mental health care provider, like we've talked about so many times. And we've been on our soapboxes. If you don't want to practice mental health, you shouldn't be in medicine because everyone has some component of going through a mental health related condition. To be empathetic, you have to be there and you got to know where to send your patient or how to manage or at least get them in a safe position and provide resources. Like that's the bare minimum. And EDS is kind of the same way. I'm not asking you to be able to pull out the criteria and say, here's your diagnosis, but recognize it that these symptoms are a large systemic scale and you could be missing this diagnosis or you have the ability of changing someone's life because you're recognizing it. Say that they come to you in your psych clinic or your office and they're saying, you know what, I've been diagnosed with anxiety. I was put on an SSRI from my previous psych provider. Has anyone thought of screening you for EDS? You know, there's just such an overlap, whether you're in orthopedics, you're in dermatology, you're in cardiology. We just need to be at least aware of this. You don't need to be an expert, but we have the ability to change lives just by simply being aware. By being aware and being able to empower our patients to think beyond and connect the dots for themselves. That's it. We just need to not miss it. That's it. We don't need to know it all. We need to not miss it all.
Yeah, and I think that it goes back to remaining curious. One of the mindsets I've had is like, yeah, I know a lot, but I don't talk about that I know a lot. It's just that I know enough to question, this doesn't feel right. And I'm going to think about it, research it, consult with someone. So just having that ability to reflect when you're doing your clinical work. You and I totally believe that mental health is in every aspect of practicing medicine. I completely agree. That's why I say every PA is a psychiatric PA
Every
because
single thing.
we practice mental health. And if we're not looking with that lens, we are doing a disservice to our patients. We need to be looking at both their physical and their mental, and the mind-body connection exists. And I think that I run into that a lot where patients come in and I tell them, I can't just treat you in silo. I have to figure out what's going on physically. What are these GI issues? Tell me a little bit more about that. It all connects to their mental health as well. Every PA is a psychiatry PA, and that's one of the reasons why I wanted to talk about this topic, because there is a collision between these psychiatric and physical symptoms, and we just have to be willing and open to check it out, to be curious.
Right. I just kind of want to echo that and kind of correlate the two. When you have a physical condition, it can worsen your mental health. And when you have a mental health condition, it can manifest physically.
Mm-hmm.
They're highly correlated. And it's just like EDS. Everyone says, I hate the language they use, but that's the crazy person disorder. Well, no, it's not. Just because you have EDS, it's not caused from anxiety. Like they do not equal out each other. Anyone who has EDS is probably going to have some type of mental health related condition because their health is deteriorating and they're going through a lot of grief. There is going to be an associated anxiety or depression or grief or whatever it might be with that. But they're not exclusive to one another. And I think that's the hard part is they see EDS in the chart and they think, oh, this person has illness anxiety disorder. We've got to stop with that stigma and that label because that's when we're going to start harming our patients.
Yeah. I love what you bring to the table and what you're doing on your Instagram. And I'm thankful that you wanted to chat with me because I believe in how your story is empowering for both patients and providers. I hope that people follow what we're talking about and increase the reach of making change, continue making our medical practice even better. I mean, our patients deserve it. And as research shows, especially with burnout, the more that we connect with our patients, the more we feel like we're going to keep doing this, right? There's a lot of burnout in the PA profession, medical profession. The more that we remain curious, I think the more that we feel like we're making a difference, even though we have bad days.
Absolutely. Validation is everything for a patient with EDS, and same with patients who are going through a tough time and needing that mental health support. I truly believe that, whether you are suffering from a mental health condition or EDS. Because if you're constantly being gaslit, you are going to believe those thoughts and you're not going to move outward. If you have a provider that hears you, sees you, and believes in you, that's honestly all you need. I would rather have a provider that doesn't have a lot of education in EDS or expertise, but they're willing to learn. They believe me and respect me as an individual. That's what matters more to me than anything else in the world. And I
Yeah.
think that's for any specialty. We need to be treating our patients like human beings.
Yeah. I always say we want to be treated the way you would treat your family member or your younger self, with that soft understanding. You need to be heard, because the more we shame, blame, and it might not necessarily with words, but with body language or the way they look at you, the more I've been practicing, the more I realize that connection is not just with words. It's really about the way you're actually leaning in, listening, like your eye contact. And so the more that we can work on that as providers, I think PAs do an excellent job. The reason why I'm into education is I think we all need to make sure we warm up these skills and get better.
Absolutely. Us continue to have conversations about mental health and destigmatizing it and talking about it when it feels uncomfortable, being vulnerable with our own experiences and humanizing it. It's the same thing with chronic illness. The more we can do that, the better outcomes we are going to have for our patients. And it's going to make a lot of change in the end.
I love that. Let's go ahead and say, continue, let's breaking the stigma. Let's keep on changing the narrative. Let's keep on working together. We're two PAs here to help support our PA colleagues, as well as also we want to educate about, the collision between psychiatric and physical symptoms. We wanted to highlight EDS. So we do have a raffle to give. So keep following us on Instagram. We're going to share the instructions in the text, but we're going to give away a conference registration that's worth like $599 at the Psych Congress in Orlando, December 11th to 13th. And you're going to meet some great, speakers, but also just a PA community. PAs that are doing psychiatry, PAs that do mental health and whatever specialty. So it could be emergency medicine, internal medicine, family medicine. So just join the community, and I hope to see you there.